This brings us to the end of the conference, and for the closing, I will leave the floor to the World Health Organization. Alain Labrique is the director of the e-health department and innovation.
En anglais, on appelle ça le post-prandial slump. Ça, c'est quand tout le sang est parti du cerveau et est entré dans l'estomac. Et je crois, on essaie de recréer un petit peu la température du Sahel.
So we're just going
on
to
se sent bien
and get back to Sahel temperature. And we're just going to try and get everybody's interest back. I was born in Asia, so I need a lot of water. I'm going to have a sip of water before
I'm going to switch to English, and hopefully I will try to enunciate so the translators can keep up with me. But thank you so much. It's really a pleasure to be with you today, and my deep thanks to the Pierre Fabre Foundation, to AHIN, and to all of the organizers, and to all of the distinguished colleagues who are here today, to be part of this dialogue and the celebration of achievement. You know, I think it's really been a fantastic day. So I'm going to say, because the winners today deserve a round of applause, why don't we all just stand up for a second and give them a standing ovation. Well done. Really, really well done. Well done. That's another sort of secret intervention by WHO, because sitting is the new smoking, and so that was my secret way of getting you to stand up and get blood flowing into your bodies. So, bravo. Do I have a clicker? I think it's a technology sorted out. So the foundation has long been a champion of innovation and the judicious and appropriate use of technology to address neglected global health challenges. And I think recognizing the innovators today have found ways to solve persistent problems. But I'd always like to start by talking about why I am here, right? What turned an infectious disease epidemiologist into a health informatician, into a passionate evangelist for digital health and innovation? And it's this powerful map. We all lived through this connectivity revolution that changed the face of the globe. You see the countries of the world here inflating based on the proportionate per capita ownership of mobile phones that happened between 2000 and 2016. And if you notice that, you'll see that there's a near overlap of the cell phone revolution and the continued challenges that I mentioned a few minutes ago of maternal and neonatal mortality. We talked about the Boeing 747 crashing every 2 days. And for me, it's not just a statistic, it's personal. As my mother and I, yes, they had color photos back then, were nearly one of these statistics. When she nearly died of sepsis, giving birth to me in post-war Bangladesh, and I nearly dying from obstructed labor. You can imagine the size of this big head. But we didn't have digital health to rescue us at that time. My father went from clinic to clinic on his bicycle because there were no phone calls that you could make, to gather 7 days of antibiotics in order to treat my mom and to make sure that I was alive. So we've studied now in my career as a digital health researcher the capacity of digital tools, sometimes as simple as a mobile phone call to save lives and change that trajectory to death, to survival. And I think during the pandemic, all of you were with us during that, and we witnessed no less than what I would call a sea change, a dramatic shift in how policymakers around the world see digital as a catalyst for the Sustainable Development Goals. And it's clear, and the data is there. We've seen now studies of how countries responded to the COVID-19 pandemic, that there's no pathway to health for all without digital health for all. And today we've talked a lot about the cutting edge, we've talked about the future of digital and AI, but digital requires us, requires us to also talk about health system strengthening. We have to talk about the way the World Bank report recently framed it. They said, stop talking about digital health. We should start talking about digital in health. And that means it's routine. It's digital as a way to pay health workers. The first example we had this morning was about M-Pesa, the one technology that has revolutionized the way financial inclusion operates in most of Africa. To optimize scheduling. I know for a fact I couldn't survive without my Outlook calendar telling me what to do from 1 minute to the next. And that works in countries to help health workers optimize and prioritize who they visit on a daily basis. To monitor supply chains so that we don't have to wait till essential drugs and commodities run out in a clinic before you realize, we need more supplies, and then you wait for a week before those essential antimalarials are available in that frontline clinic. And last but not least, and I really want to highlight the close and supportive relationship that we received from our colleagues at Google during the pandemic to make sure that people everywhere had access to truthful, reliable information about how to manage the pandemic at an individual level. So digital allows us to define the population denominator, enabling accountability systems that allow us to define whether health services are reaching all of the people who deserve to receive those services. We talk about things like the last mile. We talk about things like universal health coverage. But as an epidemiologist, if you don't know the denominator, how do you know the percent of population that you're serving? To this day, and for those of you who are not, dyed in the health field, you will be shocked to imagine that we do not count every maternal death. Maternal mortality today is still estimated. And if that doesn't keep you up tonight to think that a pregnant woman dying somewhere in Africa or in South Asia is an approximated statistic as opposed to a count, that is something that's really we need to be solving for. We need to be solving for our overburdened health workers who have already so much to do, and we keep loading them with more tasks, but we have to be thinking about how digital can optimize and enable them to make sure they're spending time caring for patients, not filling in accountability forms for one donor or the other. I also want to remind us that when we talk about digital health, we should be focusing not on the technology or the gadget. We're talking about primary healthcare. We're talking about UHC and timely, better data for decision making. We have to work at the government level so that all of these data, we talked just now about a massive treasure trove of data that's being generated by one of these systems. Is that data being used to make decisions about healthcare and optimizing resources in communities? Most importantly, we're talking about equity, including those who have typically been left out or left behind. And we know digital health, as we've heard today in many examples, digital health is a proven pathway to reduce those equity gaps. But we have to make sure we're using the limited resources that countries have to allocate to public health, that those resources are used widely, and that we're not chasing shiny objects or magic solutions to solve these problems. And that's really to credit Pierre Fabre, the rigorous process that you've used to evaluate some of these, all of these winners is really a testament to the value you're placing on evidence and not just the nicely produced video that anyone can produce today with AI. So our member states now are talking about something different. They're talking about digital transformation. Digital transformation. So transformation, when you hear the word transformation is not about incremental change. Transformation is about reimagining a health system. It's reimagining the health strategies that were developed sometimes 10 years ago, sometimes 50 years ago, sometimes 100 years ago, in a paper-based environment. So we have to ask ourselves, are we doing something today because it's the best way to do that thing? Or are we doing it today because that's the way we've always done it? That's the way it was created when we only had these stacks of paper to register all of the women in our community to whom we have to provide antenatal care. So the question I would ask all of you who have come from so far across Sub-Saharan Africa or South Asia, or for those of you coming from Central Asia, ask yourselves, are you doing things the most efficient way in 2023, or is it because that's how the system was conceived over a decade ago? WHO is the secretariat for something called the Global Strategy on Digital Health. Let me ask you, how many in the room have seen this document? So that's a bad news for me in terms of doing the appropriate public relations, because this document is a document that was created by all of the member states. 194 countries have ratified this document that's a 5-year plan from 2020 to 2025, for which WHO serves as a secretariat, outlining tasks and goals for countries, for partners, so many of you in the room are partners, and for WHO to undertake to help countries achieve digital transformation. I would love for all of you to go back and when you're looking for something to read, as you're falling asleep, pick this up and look through it and ask yourself, how does the work that I am doing in AI or digital transformation, how does my work fit into the agenda of the global strategy? Because the strategy is meant to unlock that pathway to transformation, but with one small detail. It puts government in the driver's seat. It allows government to set the rules of the sandbox so that everyone can thrive. Private sector, entrepreneurs, public sector, NGOs can work together in a common strategy to achieve that digital transformation. Last week, I was in New York at the UN General Assembly, and there were 2 topics that were at the top of everyone's list. One was digital transformation and digital public infrastructure, and the other was artificial intelligence. So let me just start with digital public infrastructure, or DPI for short. WHO believes very strongly that you cannot achieve digital transformation without investing in robust foundations in infrastructure, architecture, policy, legislation, and human capacity. It's the equivalent of building skyscrapers or health systems without the foundations or architectural plans. We wouldn't have this beautiful auditorium if there wasn't a carefully architected plan and the qualified people to actually build it and put it together. The same is true for national digital health systems. This digital implementation investment guide proposes this generic blueprint, as you see here, for this transformation journey. And it's important to see where it starts. It starts here with national priorities and the digital maturity of the country. That's what helps create the strategy that leads to the roadmap, that leads to something that my team keeps telling me at WHO. They're like, Alain, don't go to Pierre Fabre and talk about enterprise architecture. This is not what they want to hear. But enterprise architecture is sexy. It is the thing that we all need to be going out there and telling our ministries. Do you have a strategy for enterprise architecture? Because without architecture, we're just building in the sand. And within a few years, those things dissolve and slip away into the ocean. So we have to make sure we're moving forward with building architecture. We've seen, and this is data, if you don't believe me when I tell you architecture is sexy, this is why. The Gates Foundation commissioned a research to look at all of the investments that have been made over the last 15 years on the continent of Africa. And what you see here is the number of tools, 880 apps and platforms mapped by the Gates Foundation, only less than half of which have scaled nationally. Less than half of which have scaled nationally. So it's important to understand that if they're not supported by an enabling environment, they don't fit into the national strategy, and these enabling environments don't support them with viable, sustainable business models, these systems don't flourish as part of a complex health ecosystem of other solutions. And it's really that interoperability that we have to be thinking about. So WHO has been involved in supporting member states in digital health for over 2 decades, with many member state resolutions and a global strategy that I just described that encapsulates our mandate to help bring leadership to the space and help to serve and support the countries who give us that mandate. Over the last 5 years, there's been the formation of a new Department of Digital Health, which I have the privilege of being a part of. And there have been some key technical products, including evidence-based guidelines, which I'll share with you in just a moment, as well as a classification of terminologies around digital health. And we have colleagues in the room who are using that classification and even making it better, as well as the Global Strategy 2020 to 2025. We've published this implementation and investment guide. So these are some of the resources for those of you who represent governments or work with governments. These are some tools that you can take back to say, are we following these guidelines that have been developed with some of the best minds in the world to help guide countries to move forward? The evidence-based recommendations for digital health system strengthening, it's great to see that many of these things are strategies that were reflected in the winners of the awards today. That from birth registration to death registration to telemedicine to supporting health workers, these tools in digital health are being used across the digital health landscape. We're excited by a number of new activities that were launched in this calendar year. I'm just going to take a moment to share them with you because I think they have implications for the work that you're doing. One is the new Global Digital Health Certification Network. And this is supporting a number of member states. Currently, at one point, we had about 84 countries as part of this network. We hope to make it as far as 194 countries. But this allows people, yourselves in the room, to cross from one country to another, carrying certified health information about yourself that other countries will accept. Many of you who lived in Europe experienced this during the pandemic, where you in France could take a COVID certificate and go to 80 other countries where they would accept your COVID certificate because you were part of a broad trust network. So digital yellow cards, portable health records, these are things which this kind of trust architecture enables. WHO now serves as the trust anchor or the phone book for this public key infrastructure, allowing people to move across borders with their official health information. Someone earlier asked me about telemedicine, and this is the architecture that enables cross-border telemedicine. Imagine a future where you can get care from a doctor who speaks your language instead of the language of the country you're visiting. We just launched, and something we're very excited about, a global initiative on digital health. And this is something that we're hoping all of you today who are in the room will become a part of. Whether you're a foundation, whether you are an implementing agency, a ministry of health, this is an initiative that looks to align and amplify the work that you're doing so that it doesn't stay trapped within your country or your region, but the entire world can benefit from those insights. The 4 pillars of this global initiative will help countries accelerate how they express their priorities, make sure they have the technical, financial, and human resources that they need to make sure they can undertake digital transformation, make sure that they have the tools that they need in terms of whether it's AI or whether it's a national workforce registry, that those tools are available, and that we have platforms for meeting and exchanging ideas like we have done today in this kind of environment. And finally, a global initiative on AI for health. So many of you are asking, how are we going to solve this problem of capacity in AI for health? And I'll say this is the initiative with ITU, with the World Intellectual Property Organization and WHO together is launched this 3 months ago. So we've drawn on the expertise of over 150 experts in the field of AI, from academia, from industry. Our colleagues over here at IDARE have all contributed to develop technical guidance on the ethics and governance of AI for health, on how to generate evidence for AI as a medical device. And I apologize if the QR codes are too small, but you'll have copies of this talk later on. And 5 days ago, we just launched this new report, which was the basis of our discussion earlier of the regulatory considerations for AI for health. I just added on the slide the QR code for the course that someone was asking earlier. So this is the course that's being offered on AI for health on the OpenWHO website, where we've had over 10,000 learners complete the curriculum. The Global Initiative on AI for Health builds on the work of the AI for Health focus group that has been in operation since 2018. So there's a lot of historical and collective wisdom that's embodied in that group. And I think we have colleagues from MIT. I put him to sleep, unfortunately, so I'm going to speak softly. The focus group, it's fine, it's fine. I'm also almost asleep, so don't worry. It's the jet lag. The focus group tackles a range of topics. He's going to get me later, don't worry. But it's focused on a range of topics ranging from the guidance that we shared earlier, but continues to work on things like data specifications, on training, as well as scale up and adoption. So if anyone is interested to be part of this think tank of advancing the boundaries of how we think about AI, please come and talk to me, and I'll point you to how to join this focus group. So just to say, for example, this document, this is the ethics document. Someone was asking earlier, does each country have to start from zero? And as Fazila pointed out, the answer is no. You don't have to start from zero because this is the collective learning of our 194 member states, which all of your countries are a part of. And for example, these are the key ethical principles that has come out as a consensus across those 194 countries as a starting point for around which you can build a national set of standards and regulatory boundaries. The Global Initiative on AI for Health will develop more technical standards and policy guidance and facilitate knowledge and data sharing, and will support evidence-based decisions on the introduction of AI solutions for health at a national level. We're prioritizing not the high-income countries, so my apologies to France, but we're going to be focusing on supporting countries who are trying to accelerate into the digital transformation. So we're looking for partners who are interested from the technical side, from a funding side, to be part of this global initiative. We're receiving at WHO many, many requests, and we're going to be expanding our capacity to help guide countries in AI. Whether we're talking about TB or cervical cancer or diabetes or AI for pandemic surveillance, these are all the domains that we're getting constantly bombarded for guidance on from countries. So guidance is being developed and will be provided as fast as we can produce it. We have several AI tools that have gone through pre-qualification processes and are currently under review. And I'll talk about just a few of those in just a moment. But I will re-emphasize again that we need infrastructure. We need architecture in order to do these things well. We can play around and have a few pilot projects that show results for a short time, but long-standing transformation has to have us investing in those foundations. The two areas of great potential that I'll just focus on, in addition to the ones we heard today, include cervical cancer, which is a highly curable, common form of cancer primarily affecting low and middle income countries. And research into AI-based cervical cancer screening is showing significant promise and is being reviewed by technical teams for both secondary and tertiary prevention. A roadmap for generating evidence for AI-based medical devices based on cervical cancer screening was published, and this is also available to study. As you're asking yourselves, how do I generate evidence for, let's say, diabetic retinopathy? Look at this document and try to mirror those pathways to do the same thing in Rwanda. Second, TB, a major cause of preventable mortality worldwide, another big focus and success story from this year's UN General Assembly, is something that is a major concern for WHO because of the impact it has not just on people, but on children. And we're seeing promising data on AI-enabled diagnosis in, especially in children, improving clinical decision-making and potentially earlier treatment detection. So you're seeing here some images from lung imaging that helps to diagnose and recommend treatment for pediatric TB diagnostics. And also AI for diabetic screening. I think the data and the evidence base around diabetic retinopathy is growing very, very fast, where AI is enabling task shifting and rapid screening in countries, for example, here, a project from Egypt that has shown a substantial promise. So I'll end with just a few reflections that AI seems to have taken the world by storm. And I said earlier, it's taken the media fascination with artificial intelligence, primarily because of large language models and ChatGPT and multimodal models, right? If you don't know what a multimodal model, it's when an AI can learn how to use a piece of software and not just interact with one space, but can create music or can direct a robot to do some work. And now you start to get an AI that is more than just ChatGPT. And there's been a lot of sensationalism and headlines that the life as we know it is coming to an end. I tried to find a few to put here on the screen. And Elon Musk came out and said, run for your lives. AI is going to be the end of us. But AI has been part of our lives now for many years in machine learning algorithms embedded in our cars. If you have a car that was built after 2017, 2018, there's an AI in there. And I don't know that it's trying to kill you. Behind the scenes in social media platforms, in Twitter and Facebook, there's an AI working to make sure the friend that you really don't want to hear from, that's the one who they're showing you pictures of. Robotics is a key discipline in AI, but we're not running from the robots. I think one key difference is the switch, and this is a very, very French thing, because in French history, the development of automata, in the 17th century, the French clockmakers were building robots that could write Voltaire poems and birds that could sing songs. You go to the museum in Genève of the watchmakers, and you'll see these beautiful birds that are clockwork. They're automata. You wind the key, and they sing a beautiful song. And that's what we like it. We like it when we push a button and we know what comes out the other end. But now we're coming into a territory where we push a button and you're not sure what's coming out the other end. And it looks and feels more like us. It looks and feels more like the humans that we work with, the medical students who make mistakes when we put them to treat patients. But we don't turn off the medical student. We train them. We improve them. We make sure they do better each time, and then we see their error rates go down. So one important thing to remember as we go into this conversation, and I apologize if I've said this 3 times today, but it's critical. AI is a very broad term. It can refer to vastly different things depending on the task that's being performed, depending on the level of autonomy, depending on the risk of the situation. And so as you speak about AI, as you speak about the opportunity, the risk, the regulatory needs, right? These are different based on whether it's a hippo, a giraffe, or an elephant, right? And I think it's important that we keep that in mind and be clear in our discussions. We had the same problem in digital health. We had the same problem in M-Health when we started. We're bringing engineers together with doctors, together with informaticians, and we all speak different languages. And so when I said, I'm going to do a trial as an epidemiologist, the engineer was saying, oh yes, I've done 3 trials. I said, really? You've done 3 trials since yesterday? He said, yeah, but we were using the word to mean different things. So it's important to have that synergy. But if there's one area I'm gravely concerned about, one area, it's the intersection of AI and disinformation. Intentionally created and propagated false information. It was a big concern for public health, for the anti-vaccine movement, for spreading lies about polio, for spreading lies about HIV. And we've known for many years that this is a political tool to erode trust in science and erode trust in public institutions. And LLM-based tools today give everyone the power to generate high-quality, believable content that can mimic world leaders, that can mimic health authorities, and convey false information in very believable ways. And we must take it very seriously, addressing it both by training people. We all need to be aware of how do we distinguish AI from real content, but we also need to think about technologies. Sorry, I'm getting a call. Let me see what this guy is asking.
Congratulations to the Foundation Pierre Fabre for this wonderful event. Bravo to the winners.
Sorry, that was President Obama. He just wanted to say thank you. You know, when he calls, I'm sorry, I have to take it. I can't just, you know. But you can see what I mean, right? So I'm really excited by these conversations. I thank you at the end of a very long day for being so patient. I look forward to continued engagement with the Foundation and WHO, with all of you. Let's use these tools to change the world for good. Thank you.
Merci beaucoup Alain Labrique pour cette somme de connaissances que vous nous transmettez.
For the sum of knowledge that you are sharing with us, and your enthusiasm and your humor, which could almost be British.
C'est donc la fin de cette
So this brings us to the end of the conference.
Pascal
will be joining me immediately. Beatrice.
Un dernier mot de la fin.
Yes, for the conclusive words. Well, not the after this brilliant closing keynote and the vision of the WHO and all of this work and this global vision. What more could I say? Well, actually, we have a lot more to read in order to fit into this global vision in terms of our experiences in the field. Thank you to everybody, to all of our panelists. Congratulations to those who have so truly deserved the awards given today. I would also like to thank ourselves, the organization.
Qu'on peut applaudir.
And we can give them a round of applause, yes.
C'est un gros boulot.
It's such a lot of work. It's taken many months to bring all of this together. So thank you, Maxine and Caroline. Thank you to the team who looked after the logistics, and Marine, Deborah, Vicky. I hope I'm not forgetting everybody. Of course, thank you to our committee of experts who are all here with us today, Giacomo and
notre ami Jai.
Our friend Jai. I would just like to remind you that this conference has been filmed and it's visible by streaming. So, and it will very quickly be accessible online. And it will be subtitled in English and in French so that you can pass it around. So I would like to say to everybody here that this is a key point for the Observatory, but the Observatory is an everyday endeavour. So please don't hesitate to contact us. We try to make the networks as fruitful as possible among ourselves, among all of those who are listening to us. So do get in touch with us. The challenges are tremendous and also very exciting, and we'd like to feed this large community so that technology can be as inclusive as possible and then it can help to improve the health for all. Thank you very much. Thank you very much, Beatrice. Thank you to the Foundation. Thank you to those who were with us remotely, and see you next year.